Pravastatin side effects and how to manage them. Pravastatin is a widely prescribed statin medication used to help lower high cholesterol levels and reduce the risk of cardiovascular events. While it is generally well tolerated, like all statins, Pravastatin may cause side effects. Fortunately, these side effects are often mild, and many people experience no issues at all. Because Pravastatin is usually taken long-term, understanding potential side effects, both common and rare, is important for maintaining your health and safety. Below, we explore some of the most reported side effects and how to manage them effectively. Muscle pain. Muscle pain, often referred to as statin-associated muscle symptoms, is one of the most common side effects of statins. With Pravastatin, the likelihood may be lower compared to other statins, but it can still occur. Discomfort can range from mild aches and cramps to more serious muscle injury. Symptoms typically appear in the thighs, back, or shoulders and are more common in the first few months, but they can develop at any time during treatment. If you experience muscle pain, inform your healthcare provider. They can help determine whether Pravastatin is the cause and may suggest adjustments, such as lowering the dose, taking the medication every other day, or checking for drug interactions. Seek immediate medical attention if you notice severe pain, dark-colored urine, or sudden muscle weakness, as these may signal rhabdomyolysis, a rare but serious complication. Nausea and vomiting. Some people feel nauseous after starting Pravastatin, and in some cases, nausea can lead to vomiting. These effects often subside as your body adjusts. You may take Pravastatin with or without food, but if you notice nausea on an empty stomach, try pairing your dose with a light meal. Avoid spicy or overly sweet foods that may worsen discomfort. If symptoms persist, your pharmacist can recommend suitable over-the-counter options, such as bismuth subsalicylate. Contact your healthcare provider if nausea or vomiting is severe, as a dose change or switch to another statin may be necessary. Upper respiratory tract infections. Some people taking Pravastatin report upper respiratory tract infections, URTIs, such as colds, sinus infections, or pharyngitis. These are usually mild and resolve without medical treatment. Rest, hydration, and over-the-counter remedies like decongestants or cough suppressants can help relieve symptoms. If your symptoms do not improve within 10 days, or if they worsen, consult your healthcare provider. Persistent or worsening symptoms may indicate a bacterial infection requiring further evaluation. Diarrhea. Diarrhea can occur in some people taking Pravastatin. This side effect is usually mild and temporary, improving as your body adjusts to the medication. To help manage symptoms, limit foods that can worsen diarrhea, such as fried, fatty, or heavily processed items. Staying well hydrated is essential to prevent dehydration. Over-the-counter remedies, such as bismuth subsalicylate or loperamide, Imodium AD, may provide relief. Always check with your healthcare provider before adding new medications, even non-prescription ones. If diarrhea lasts more than a few days, or if you experience fever or bloody stools, contact your healthcare provider promptly. Headache. Headaches are another possible side effect of Pravastatin, though they are typically mild and temporary. For occasional discomfort, over-the-counter pain relievers such as acetaminophen, Tylenol, or ibuprofen, Advil, Motrin may be effective. Consult your pharmacist for the most appropriate option, especially if you are taking other medications. If headaches are persistent, worsening, or severe, notify your healthcare provider, as they may need to adjust your treatment plan. Severe muscle damage, rhabdomyolysis. Although rare, Pravastatin, like other statins, can cause rhabdomyolysis, a serious muscle condition in which muscle fibers break down and release substances into the bloodstream. This can lead to kidney damage and dangerous electrolyte imbalances. In severe cases, it can be life-threatening. Key warning signs include severe muscle pain, sudden weakness, and dark or tea-colored urine. If you notice any of these symptoms, seek medical attention immediately. Higher statin doses and certain drug interactions can increase the risk, so it's essential that your healthcare provider has an up-to-date list of all your medications and supplements. Liver damage. Pravastatin may cause elevations in liver enzymes, which can indicate inflammation or damage. In most cases, these changes are mild and resolve on their own. However, serious liver injury is possible, especially in people with existing liver disease or chronic alcohol use. Your healthcare provider may recommend blood tests to monitor your liver function before and after starting Pravastatin. Seek medical advice promptly if you experience symptoms such as dark urine, severe abdominal pain, extreme fatigue or weakness, loss of appetite, yellowing of the skin or eyes, jaundice. When to contact your healthcare provider about Pravastatin side effects. Most Pravastatin side effects are mild and tend to fade as your body adjusts to the medication, which may take a few weeks or longer. However, if any side effect begin interfering with your daily activities, contact your healthcare provider. Do not stop taking Pravastatin without medical guidance, as there may be adjustments, such as lowering your dose or changing the dosing schedule, that can help you continue treatment safely. Seek immediate medical attention if you experience severe muscle pain accompanied by weakness and dark-colored urine, as these may be signs of rhabdomyolysis. The same applies to any side effect that feels severe, unusual, or life-threatening. The bottom line: common Pravastatin side effects include nausea, vomiting, diarrhea, and muscle pain. These are typically temporary and manageable. Rare but serious side effects, such as severe muscle damage and liver injury, can occur, which is why monitoring your symptoms and staying in touch with your healthcare provider is essential. If Pravastatin is difficult for you to tolerate, your healthcare provider can recommend alternatives, such as adjusting your dose, changing how often you take it, or switching to another medication. With the right guidance, most people can find a safe and effective treatment plan that works for them. For more trusted, science-backed health information explained clearly by experts, subscribe to the HeInfo channel and explore our library of videos designed to help you make informed decisions about your health.